urgent care, doctor's office, or something else. When you get sick or hurt, you have a choice to make.
For most of the common conditions, there are a lot of different options.
But which option is the right one for you?
It can be difficult to know how severe your symptoms are and what degree of care you need.
They want the path of least resistance. They want what is most convenient for them.
Today we go inside your health on this familiar medical holdup, getting care, and choosing wisely.
That question, should I go to the doctor, trips up a lot of us when we get sick or injured or just aren't feeling well. We want to make sure we're picking the right place for our symptoms, and we don't want to pay more than what's necessary. So today we're going to lay out all of our options and how to make the best decision for you. We're joined today by KSTP medical expert Dr. Arkel Giorgio. This is something, Arkel, everyone's going to have to deal with at some point in their life.
This is going to be a practical special. This special focuses on one aspect of what healthcare consumers can do to decrease the cost of their care, and that, Lindsay, is where they get care. There's a range of options from in-store clinics to your doctor's office to urgent care to the emergency room. The big question is, how do you know where to go? Because the place you select makes a difference to your health. That's most important, but it also makes a difference to your time and to your checkbook.
Absolutely, and we wanted to see where both patients and doctors would go with a certain set of symptoms, and then we compared their responses. So I went out and talked to potential patients, and Arkel, you talked with some medical experts. Let's look at the first set of symptoms.
Okay, so the first one is you've had a cough and a runny nose for a few days. You're now congested, have a low-grade fever around 100. You've already taken a decongestant, ibuprofen. You use an inhaler for some asthma symptoms.
All right, well, let's listen to what the patients had to say in their answers and then the pros.
Probably go to an urgent care just to see if it was a sinus infection or any other type of something would need antibiotics.
Oh, I'm going to the doctor. I'm going to my local clinic and to get a checkup to see if I have a cold or flu or whatever could be going on with me. I'm definitely going to the doctor.
This sounds like it's going to be something more viral if they're able to talk to me and they're feeling pretty well otherwise. Certainly an urgent care or a minute clinic, I think, could handle some of these things.
I would advise this individual to wait until they've had symptoms for 10 days or so before they would seek care.
Since this is a cold flu season, I would say for now, they can just take care of it at home. I would just give them some home care remedies options, what they can do at home, and to monitor how they are feeling.
All right, the next set of symptoms, Arkel.
Okay, here's this one. You develop some new low back pain. It's in the middle of your back. You've had it for 2 days, but you haven't fallen. There's no trauma. There's no weakness. You're able to walk, but it's hard to sit, getting in and out of your car. You can't work. You're downright a little bit miserable.
All right, let's give it to the pros and let's give it to the patients.
I would wait it out a few days, see what happens, and then same thing, probably a walk-in clinic.
So I'm assuming I've already tried like heat pads and ibuprofen at this point.
That could be a part of your care. Was that what you would maybe do?
I would probably try that first to see if it took care of it. If it continued, I'd probably just go see a general doctor.
I would say make an appointment with your doctor.
He could seek care either through a nurse line, a virtual care visit, or a visit to an urgent care or a primary care provider.
I would say a virtual visit would be fine for this, because then you could go online. Since you're not able to get on a car, you could still sit at home, answer all the questions that would be sent to a doctor, and they could advise you what to do.
All right, Arkel, the third and final set.
Okay, so this one is a little bit different. You are looking at your older parent. They're around 60, and they say they're feeling fine, they're eating fine, they're walking fine, but they just seem a little bit off. They're using some of the wrong words for common things that they should know. What would you do?
This was an interesting one for the patients. Let's hear from the patients and the pros.
I would monitor it, and if it seems as though it's getting worse, I would go in, because that sounds like something's going on possibly with the brain.
I would take them probably to the emergency room or walk-in clinic. Yeah.
Would you do it immediately, or would you give it a couple days?
I feel like there's more urgency there.
Those sound pretty close to what the signs of a stroke could be, which would be serious. Go with your gut, bring her to the ER.
Either urgency room or emergency department for that. That if they're otherwise walking and talking, looking well and a little confused, the differential's pretty long. I think we could certainly manage that here. Obviously, the emergency department for a backstop would be reasonable, but certainly you come to our facility with those symptoms and we think there's a stroke, we get the right stroke team involved right away.
ER. Because you're getting at stroke here. Yeah.
Wow, these are so interesting when you look at them side by side, the pros and the patients. Arkell, I'm sure a lot of people consider what symptoms they have, but also when they're trying to figure out what to do, where to go, they think about the cost.
And you have to balance both. So the difference in cost when you visit different facilities with the same set of symptoms can be dramatic. Based on a study published in the Annals of Internal Medicine, the average cost of a visit to treat common things like an ear infection, upper respiratory infection, or sore throat can range from $207 at an in-store clinic to over $1,000 at an emergency room. So why such a huge difference? Because the cost for the doctor's time and the cost of x-ray and lab tests is significantly higher in the ER than in a non-emergency room setting. And all of that ends up with a very big bill.
Those are some big price differences right there.
They really are.
All right, we have a lot more coming up in our Inside Your Health special. Up next, a doctor and hospital CEO will be here to explain the difference in healthcare cost and what you as the consumer can actually do about it. And later, we'll take you inside a different kind of emergency room, how the urgency room operates without a hospital attached.
Welcome back. Well, so far we've shown you the wide range of choices people make when they have certain symptoms. But what's the right way to make that decision if you aren't a doctor and don't have medical training? Today we're joined by Dr. Kevin Croston. He's a physician, a general surgeon, as well as the CEO of North Memorial Healthcare. Thank you for joining us. Dr. Croston, you have a very interesting perspective. You have a deep clinical commitment in your life as a surgeon, but you also have a financial commitment. We saw in the previous segment that patients make really different decisions than clinical professionals when they're faced with symptoms. Why is that?
Well, the information's not out there for them that's easy to access. I think one of the things you find when you do this kind of work is that there's good news and bad news, right? And the good news is that it's there for you if you look for it. You have to look pretty hard. The bad news is that sometimes you have to chase it out a little bit. So what's an emergency depends on who you're asking the question from. If you're the patient, the definition of an emergency is it's happening to me, and you want to go to where you're going to get an answer, and the cost seems less important at that moment you're making a decision. The good news is that there's a scale, and if you can think of it, establishing a relationship with a primary care doctor has never been more important. Being able to navigate a really complicated healthcare system takes a friend, or it takes somebody that knows it to help you get through it. And having a primary care doctor or their office help you make decisions where you can make a phone call and expect a quick return really makes a difference for some folks, and it makes a difference in the cost of things.
But yet in that segment that we just saw, I was fascinated at how few people said that they would call their doctor's office and wait for an appointment. So when is it worth the wait? Because everybody wants their answer now.
Right. Well, that's the hard part. And so, I think historically it's been hard to get into physicians' offices. I think health systems are trying to make a better effort at having walk-in available appointments so you can get in, and that's almost always going to be your cheapest option. I do think that things are changing. There's a lot of social disruptive technology out there that is making it easier to do things online. And so, again, I think if it's a symptom you're concerned enough about it that it might result in you taking a medication or something, you probably need to start with your physician's office. If you think you're going to end up in an emergency room, possibly being admitted to a hospital, I said that backwards. If you're going to be admitted to a hospital, you maybe want to end up in an emergency room. And if you're just worried that it's something serious, then probably having that conversation with your primary care doctor who knows you and can kind of say it's not worth your time at this point in time, but it might be down the road when these things happen, can be reassuring if nothing else.
So I'm going to have one last question, and I'm going to ask you for a quick answer just because we don't have a lot of time.
Sure.
But we're seeing really big deductibles. In 2017, the average deductible for a family who gets insurance is $2,500. If you get insurance through the exchange, it's $7,500. The goal of these high deductibles was to make people better consumers. Do you think it's working?
I think it's too early to tell. Clearly, it's really complicated, and pricing in healthcare is so bad. I mean, I think that very few people receive a healthcare bill they understand. And so that's up to us to fix. I do think that we're not going to be able to fix it or even have an intelligent conversation until the patients have some way of having input into what we're doing. And so I would encourage our patients, or the patients that are out there, to ask questions about their bills, to ask questions about what costs what when they look at it. And certainly having a deductible where you're responsible for it should drive that, because there's wide price variation based on where you go. And it's important to know that up front. And if your health system that you contact doesn't know that answer, go somewhere else, because we're supposed to be able to give you that information.
Great advice. Thank you so much. Thanks for joining us. Lindsay, back to you.
Up next, we'll show you some of the innovations being made in examining and treating patients, how virtual visits are changing the traditional doctor's appointment. And think of it as an emergency room without the rest of the hospital attached. We'll show you how the urgency room operates. More healthcare providers are going digital when it comes to providing care to patients. Many now offer virtual appointments where you can do an online or video chat with a nurse or a doctor and get a diagnosis right on the spot. Joining me today right now is John Pierce. He's the CEO of Zipnosis. It's a virtual care platform based in Minneapolis. Thanks for being with us, John.
Sure, thank you.
All right, let's talk about the conditions. What can you go and do with Zipnosis?
Really very simple acute conditions, things like sinus infections and bladder infections and pink eye, the most common conditions that we can treat.
All right, let's look at an example here. And I want you to walk me through what a patient would see on the other side when they went through this. Just so our viewers know, the example here is that you possibly have pink eye.
That's right. And so the idea is, how do we make it really easy for you as a patient to get access to care for very simple conditions? So in this case, what you're seeing is how a patient would interact with our platform to get a diagnosis for pink eye. So you're going to see a list of conditions, and then you're going to start to see a series of questions that a provider would be asking you face-to-face. But instead of being face-to-face with the provider, we've effectively outsourced it to really smart computer systems. And then you can upload a photo that the provider can review very, very efficiently and make a diagnosis and treatment. And the best thing is it's very mobile, so it fits into the slipstream of your life. So you can pull up a Google map if you have a prescription and send it there instantly.
And you can write prescriptions through Zipnosis?
So the healthcare providers who use the system will write a prescription for you as needed.
Right. When you're sitting there, who am I looking at on the other side of the screen?
You're not looking at anybody, actually. It's kind of more like you're buying something on Amazon, and you're interacting with it on your own time, and you send it to the local healthcare provider, and they get back to you within an hour.
Okay, the big question I know everyone's thinking is the cost.
Very, very cost effective. So average price for our customers is between $20 and $30.
Wow.
Yeah.
Pretty reasonable there. All right, thank you so much. Arkel, back to you.
Thanks. Well, another innovation we're seeing is moving healthcare out of hospitals and into freestanding facilities. So we're all familiar with surgery centers, birthing centers, infusion centers for chemotherapy treatment. And more recently, emergencies are being treated in freestanding emergency rooms. I visited one of these facilities in Eagan called the Urgency Room, and to see what makes it different than the traditional ER.
Approximately 75% of all emergency visits end up going home. Our intention back in 2010 was to create an environment that was very patient-centric, that allows for an emergency department-like workup by emergency physicians outside of a hospital.
The Urgency Room was founded by a group of emergency medicine physicians, and the concept was the first of its kind in the Midwest. Dr. Thomas technically and legally refers to the Urgency Room as an acute care clinic, but it was clear to me during my visit, it is so much more.
The Urgency Room has advanced imaging, so we have a CT scanner, we have X-ray, we have a high-complexity lab that can run the majority of the tests that an emergency physician would need at an emergency department.
This room is for people that have chest pain, shortness of breath, really critical cases.
The Urgency Room also has monitors in the waiting area so patients can see their wait times. But as you might expect, I asked about the quality of care. What happens if somebody needs emergency surgery?
I will talk to the surgeon, and they'll take you into the operating room directly from the urgency room.
Versus the same complaint taking 3 to 4 hours when a patient is seen in a hospital-based emergency room. And then there's the cost factor, since other freestanding ERs have come under scrutiny for excessive fees. The Urgency Room contracts with large local insurers, including Medica, Health East, and Blue Cross. Dr. Thomas estimates that the costs are 30% cheaper than the same care delivered in a hospital-based emergency room.
And freestanding emergency rooms offer a great alternative to hospital-based emergency care. But even the doctors there still recommend calling 911 and going to a traditional ER for very serious emergencies, such as trauma, unconsciousness, or difficulty breathing.
All right, we've hit a lot of high points. Arkell, what would you say are the main points you want to take away from this?
Well, there's 3 key takeaways to choosing wisely. One is you have a choice on where to get care that ranges from virtual and retail clinic visits to the doctor's office, urgent care, freestanding and traditional hospital-based emergency room. Number 2, use the ER for true life-threatening emergencies. You know, 88% of people who go to the ER for care are discharged back home, which means that they could have received care in another location that was cheaper, faster, and maybe even better. And 3, I recommend that you create a contact list for this whole range of options so that you aren't scrambling to figure out where to go when you don't feel well, get hurt, or have an emergency.
I think that's a great point, because when you don't feel well, you're just not making the best decisions for yourself always.
That's right.
And you're prepared no matter what.
It's just going to be a delay.
All right, and to see more from today's Inside Your Health special, go to KSTP.com and click on the quick link at the top of our homepage. Arkell, thank you so much. Dave Dahl has your forecast when we come back.